the interdisciplinary treatment approach for chronic pain management. Yeah. So the traditional approach to the healthcare in general, but chronic pain in particular, has embraced a dualistic perspective that concentrates the mind and the body. Yes, so one more time we are just stressing this holistic approach, the approach when the psychological, social and physiological factors are taken into consideration. So we need to address all of these problems, not only muscles, bones and joints. One more time, easier said than done. However, this is the official way how to think about this. So, there are 4 distinct psychosociological processes have been identified in pain: transduction, transmission, modulation, and perception. So, transduction of or receptor activation is the process when one form of energy, so chemical, mechanical, or thermal, is converted into the other. In this case, electrochemical nerve impulse. So, generally, we have some damage of the tissues. This damage of the tissues will lead, for example, to release of some substances, and these substances will be changed into the action potential in the nerves. Then transmission refers to the process by which the coded information is related to the structures of the central nervous system. So we just need to get this signal through to the central nervous system, to the spinal cord and the brain. And these messages, so the message about the pain, elicits a variety of responses ranging from withdrawal reflexes to subjective perpetual events. In addition, the responses of the central nervous system neurons to noxious stimuli are variable, yes, because they are subject to inhibitory influences elicited by the peripheral stimulation originated within the brain itself. Yes, so we'll get to this in a moment, but the central nervous system can also affect how the pain would be perceived. Yes, so and this is called the modulation. Yes, so the central nervous system may inhibit the pain for some extent, yes, while producing internal opioids, internal cannabinoids, and by various other mechanisms that we will not delve into details now. However, it's good to know that the central nervous system has a lot of ability to control how much pain we'll get from the tissue, so from the source of the pain to the brain itself. The final process involved in pain is perception. So perception, somehow the neural activity of the nociceptive transmission neurons induces subjective experience. This somehow is very well taught, yes, we do not know exactly how it is done. And this is a psychological rather thing. Theoretically, all psychological conditions should be explained somehow by the neurologic examination, but it cannot. Yes, because it's too complex. At least for now. So, generally, when we are thinking about this in such a way, we need to think about these physiologies. So, transduction, transmission, modulation, and perception. Yes. So, on these first 3 phases, we can act through the pharmacotherapy or physical therapy. On the last part, through the psychological means. Yes. Also, psychological means are important to get the proper coping strategies to be elicted in the patients and to reduce some pathological behaviors that can make the things worse. So we also need to remember that there are some psychological predispositions of some patients to have increased perception of pain, and such existence of those may lead to problems. Yes, we may need to address them if possible, obviously. So, from the cognitive behavioral perspective on the treatment of chronic muscular pain, about this next time.